NMC introduced a program called CBME, that is Competency Based Medical Education, starting from the batches of 2021, under which we had a program called as Family Adoption Program or FAP. So for that, all of us were asked to go to the field and we were assigned around 3 to 5 families. And we took the data of each of the families and we have compiled here. The key features of the FAP, this Family Adoption Program, was if you are able to go to the field and learn at early stages how the field behaves, how the community lives, how they are going, what diseases they face at the ground level. If you are able to learn this early in your career in the form of this family adoption program, this will help you to shape future opinions, future how you treat patients, your communication, and further if you become a lawmaker or anything, you will be able to shape the future opinion. So if you are able to introduce things early, you will be able to continue and go till last. So we have been divided into 3 groups and around some posters have been done, compiling the data of each of the groups. So here we have the data in our department.
First batch period, this was 1 year. Across 3 years, that everyone is still in a grad and we collected data from the so I can see that data and footprint that certificates. This is the area map from our college here up in the area. So we put up two graphs to show the age distribution as well as the age sex distribution. That's social demographics because we have put up a key difference to easy that will pay. The housing environment and the major concerns we noticed here. Major concerns that we noticed were that there was poor waste segregation as well as lots of areas of block stagnation and open drainage systems. So which caused a lot of the challenges of breeding and vector-borne disease. Now more than 12 the high prevalence of and poor nutrition because we noticed that both 51 is the variation, both over the age 60 and both over the age. Along with that, we noticed that based on hypertension, diabetes, and obesity, that we have effects of patient loss. And we've also included some suggestions from our guys that we could improve the conditions of development.
I'm Chandana Deshpande and I am from the groups of the second group, that is from row number 13 to 24. And this is the data we have collected from the family adoption program and the analysis has been put up here. The study area that was we have studied in Bangadi, which comes under Handipnur PLC. Population covered we have covered is around 132 people and we have surveyed around 36 families altogether. And upon screening for the NCDs, this is what we have understood. 31 people were diagnosed as anemic patients and 12 were diagnosed as with increased blood sugars and 18 people had increased or higher blood pressures. And we did have some IEC activities and healthcare activities. Here we can see we had an activity on menstrual health and hygiene. This was for screening for non-communicable diseases. We had herbal trade plantation activities. It was a great experience overall to learn on the field. Thank you.
Hello, myself Lucky Jain. Today I will be explaining about the family adoption program and a summary of it, which is conducted by the students from roll number 37 to 48. This program was conducted in the area Bangrali village, which was located, and we had 10 visits in total that we covered. And in those 10 visits, we had adopted 60 families, which had a population of 230 members. Looking at the activities that we did, initially we did the data collection, we had screened them for diseases also. There is a photo in which you can see the screening has been done. BP was checked, the blood sugar was also been checked for them, and also anemia was looked after them. Next, we had 2 IC activities that we did. The first IC activity that you can see here is, we have the tree plantation, herbal tree plantation was done, for which the medical remedies and all those importance were explained to the families. The next IC activity that we can look here is, it was about the national programs that we had as kit and also national vector-borne disease control program. We had explained them the measures to prevent the vector-borne disease transmission. And at the end, here are all the summaries and the pictures that we can look. Yeah, thank you. We are representing from roll number 123 to 135, and we are going to explain about the family adoption program which we have done for course of 3 years. And as you can see that we have adopted 5 families each, and a total of 50 families containing 206 population, and we have provided them with hand hygiene and balanced diet correction and walking, sports, yoga, and we have told them about sleep and mental health, and we have spread awareness about vaccinations for less than 5 years of children, and we have screened patients regarding diabetes, hypertension, malnutrition, and anemia. And we have advised them to please come to our school hospital for further references and for free treatment. Thank you.